mynews.studio.
A handful of peanuts used to mean danger for many adults, but now, in a recent allergy trial, those same peanuts might stand for something like freedom. But does this really mean we've reached the end of lifelong fear for these adults?
Today is July 16th, 2025. For years, adults with peanut allergies have had to live with the risk of severe reactions. Most of the research and treatment options have focused on children. Why has that been the case? Why have adults mostly been left with avoidance and emergency medication as their only options?
That's a good point. The main reason is that adults have usually been excluded from clinical trials, based on the idea that their immune systems don't adapt as easily as children's. The Guppy trial, short for grown-up peanut immunotherapy, challenges that thinking. At Guy's and St. Thomas's in London, researchers enrolled 21 adults between 18 and 40, all with confirmed severe peanut allergies. They started each person on very small amounts of peanut flour mixed into food, all under close supervision.
When you say very small amounts, how small are we talking?
Less than 1/8 of a peanut, measured in milligrams. Every 2 weeks, the dose was increased, until some participants reached 1,000 milligrams. That's about 4 large peanuts. The aim was to see if adults could safely tolerate 1.4 grams of peanut protein, which is roughly 5 peanuts, without reacting.
So how many people actually reached that goal?
About 67%. So 2/3 of the group could safely eat the equivalent of 4 to 5 peanuts after completing the protocol. Most of them started out unable to tolerate even a trace of peanut.
Just to clarify, these were adults who couldn't be anywhere near peanuts before, and now some can eat several peanuts?
Yes, exactly. The median tolerated dose went up by 100 times. For many participants, this changed daily life. They talked about feeling less anxious, less worried at meals, social gatherings, or when traveling.
Did anyone have serious side effects during the trial?
A few participants did withdraw, mainly because of mild reactions, not severe ones. Most finished the trial without any major complications. The safety results were similar to what's seen in oral immunotherapy studies with children.
That seems important. But does this tolerance last, or do adults have to keep eating peanuts every day to maintain it?
That's still being studied. Right now, ongoing daily exposure is needed to keep up the desensitization. We don't have enough evidence yet to say if tolerance remains after stopping treatment.
So it's more of a way to manage the allergy than to cure it.
Exactly. The goal is to reduce the risk of accidental exposure and improve quality of life, not to erase the allergy completely.
What about cost and access? Oral immunotherapy sounds like a bigger commitment than just avoiding peanuts and carrying an EpiPen.
It is. OIT requires regular supervised appointments, gradual dose increases, and close monitoring for reactions. That means higher upfront costs and more complex logistics. For wider access, insurance coverage would need to improve, and we'd need standardized protocols for adults.
Is this method being considered for other food allergies like tree nuts or shellfish?
Yes, actually, the results with peanut OIT in adults have already led to new studies on tree nut and shellfish allergies. Some trials are already running, others are planned. Still, every allergen has its own challenges, so each protocol needs adjustment and careful safety checks.
How big of a change could this mean worldwide?
Globally, about 250 million people have food allergies, many of them adults who faced lifelong risk. This trial opens the door for more inclusive research and new treatment options. If scaled up, it could mean better quality of life and lower healthcare costs for people everywhere.
So, to sum up, adults can retrain their immune systems, but it's a process, not an instant cure. There's more to learn about who benefits most, how long tolerance lasts, and how to make this available to everyone who needs it.
That's right. This is a breakthrough, but it's just the beginning of changing how we approach adult food allergies.
That wraps up today's conversation. A handful of peanuts and it could mean a world of difference. Are we about to see allergy treatment rewritten?
Thanks for joining us as we explored the facts and future of peanut allergy treatment for adults.
Thank you for listening. This episode was brought to you by mynews.studio. Give it a try for free.